Today, we are fortunate to have with us Dr. Suresh Raghavaiah, a distinguished liver and pancreas specialist and multi-organ transplant surgeon trained at prestigious Mayo Clinic in Rochester, USA. Dr. Suresh has led his team to perform the highest number of pancreas transplants in the state, and that's the third highest in India. With expertise in liver, kidney, and pancreas transplantation, Dr. Suresh is also a renowned expert in treating complex liver conditions such as hepatitis, jaundice, cirrhosis, liver cancer, and biliary diseases, making him a leading figure in this field. I am so glad we are right here with him right now at Spandana Hospital, Mysore Road. Welcome to the show, Doctor.
Pleasure to be here, Ms. Mansi.
We've got like a series of questions that people have asked.
Okay.
So these are the frequently asked questions, especially when it comes to transplant.
Sure.
And because this is the infection prevention week, I wanted to focus on it from Spandana Hospital. Doctor, this is a very funny question that has come in. I mean, for me it looks funny, but I'm sure it is something that they ask. When the infection occurs, how soon does it occur? Does it occur when you're in the ICU like 45 minutes after the or does it happen 6 hours later, or does it happen within a couple of hours or months? Okay. How soon does the infection occur?
So that is a funny question. Okay, so when you're looking at infection, what is an infection? It is basically when the bacteria overcomes your immunity system. Okay. Now, all of us have trillions of bacteria within us. In our intestines, the intestines have trillions of bacteria, but it is not affecting you. Why? Because your immunity is strong. Now, once your immune system fails, now why does it fail? Let's say you develop an organ failure, either a kidney failure or a liver failure. What happens? There's a lot of changes which happen in the body where your immunity decreases. Or let us say you have diabetes or your old age patient. So in all of these instances, what happens? Your immunity decreases. Here, what is going to happen? The bacteria are going to take up the upper hand and they're going to cause an infection. So when you talk about an infection, it doesn't have to happen 10 minutes later, 2 hours later, or 6 hours later. Infection is already there, but you're going to suffer the ill effects of the infection only when any complication happens. Now, what are the complications after transplant? Like I told you before, if the organ starts to function immediately, you're not worried. Why? Your body is healing, your immunity system develops, and it is going to take care of the infection. Now, for some reason, you stayed in the hospital for a long time, you stayed in the ICU for a long time, you had to undergo multiple invasive procedures like a dialysis or a ascitic tap. So these all things put you at a much higher risk, and that time the immunity can get overwhelmed and overt signs of infection will happen. Now, after a transplant, if you had any complication like you had to operate on you multiple times for any reason, or your organ is not functioning well, that puts you at a much higher risk of an infection. Now, the last thing I would say is, if you've been on antibiotics for a long time, like let us say before your transplant you had multiple episodes of infection for which you needed antibiotics, it's going to be very dangerous. Why? All your bacteria which causes the infection will be resistant to these antibiotics, and this is what we call multi-drug resistant infections, and that becomes a huge issue after the transplant.
Doctor, we've spoken so much about infections. How do we know that it's an infection? Like, what are the symptoms? What is it that they should watch out for very closely focused and get back to the hospital?
So this is a very important question. Why? Because if me and you get an infection, let us say a common cold, what is going to happen? The first thing you're going to develop is a fever. Then you're going to develop a sore throat, you're going to develop a runny nose. But the most important thing is fever comes first. Now, in a transplant patient, unfortunately, your immunity system is down. Okay, now why does the fever happen? The fever is happening because your immune system is fighting against the infection, and that is why the fever comes. In a transplant patient, we give you medications to suppress your immune system. So in a transplant patient, fever might not occur. So this is very important to this one. So the patient may not come to you with any symptom, but you do your blood test, you do your liver function test or a kidney function test, and suddenly you'll notice that your total counts are high, your neutrophil count has gone up, your lymphocyte count has gone up, or your liver functions are altered. And this should point you to a thing that saying that yes, this patient might not have a graft function but an infection, and we might have to evaluate it further. So this is why we tell all of our transplant patients, even if you do not have any overt symptoms, the very fact that you're not feeling yourself, it's very mild, you should immediately contact your doctor and you need to come to see us. if you develop a fever, if you develop any symptoms of an infection, generally it means that you had a severe infection and we will have a difficult time to treat you. So any change in your body which you feel is out of normal, we should consider that you have an infection and we need to evaluate it.
With that, we come to the end of this episode. Thank you, doctor, for patiently answering all those questions for us. Health challenges can be, whether it's physical or mental, can be very scary. At Spandana Hospital's Mysore Road, we have specialists from all domains. So feel free to ask away your questions and our specialists will answer it for you. You can leave your questions in the comment section below and we will pick it up for our next episodes. Thank you for watching.